Okay, so in this video, I'm going to demonstrate how to apply the intermittent compression machine. So with our patient, we would have our patient in the waiting area. We would take their blood pressure so that we know what we're going to set this patient's parameters to. So just for a little reminder that if we were treating this patient's upper extremity, we would use the range of 30 to 60 millimeters of mercury for the upper extremity and 40 to 80 millimeters of mercury for the lower extremity. So patient would be over in the waiting area. We would take their blood pressure and go ahead and set up or get our area ready to bring our patient back. So one of the first things you're going to do is, at least for the skills check, is you can introduce that call bell to the patient when you give all the information, when you're taking the blood pressure and explaining the procedure to your patient. But once you get to the table and you get the patient up onto the table, the first thing you're going to do is to make sure that you elevate the limb. So you can use the wedge. That's going to help you to get the best elevation at first. And I'm going to step back here just so you can see a little bit better, but you're going to want to make sure you have nice, good control of the patient's limb because it's a large, heavy, swollen limb. So you get control of the patient's limb. You can bring the wedge in so that it can at first support that limb. That's the main thing that you're going to be interested in fixing first, is getting that limb elevated. Now, their other extremity, we'll deal with it afterwards. If the patient would like, you can have them bend that other extremity while they're laying on the table, or you can give them a pillow underneath that knee so that we can protect their lordosis. Now, we can't have any gaps, so once we have the wedge being able to support the majority of the leg, because you don't want any of the limb hanging off the edge of the wedge, then we'll use pillows to build up the rest of the space, because we're trying to get that limb nicely elevated so it's at least in line with the level of the heart so that we can get adequate venous return. So I get my pillows, and again, I carefully lift my patient's limb, and I get the pillows tucked all the way in. So you want pillows all the way in to the gluteal fold, all the way up, having that limb completely supported the entire length of the way. Now there are also a couple of other ways that you can do it. You can also elevate the limb on just all pillows, but that will require quite a number of pillows to, and it does take a little bit of skill of practicing to get everything evenly supported. And making sure that your tower of pillows is level. So once I've gotten the wedge underneath, and I basically have a nice level leg. So I'll bring you in a little bit closer, because what you're looking for is you want that elevation of the limb, but you also want to make sure that the knee's completely straight. Because if we have the knee, if any knee flexion and there's space under there, remember that's the open packed position of the knee, and it will allow any accumulated edema as you're getting it to flow down, or I should say up the leg, then it can pool in that area. So you want to limit the space that you have for any edema to settle in. Okay, so once the leg is nicely elevated and fully supported, basically from gluteal fold all the way to the heel, then the next thing I'm going to do is to do a thorough skin inspection. So I am looking at the skin, so I'm looking anterior, I'm looking lateral, I'm checking medial, and I'm just going to slowly bring their leg up to check posterior. I make sure I look at the heel, I look at between the toes as well. So you do a thorough skin inspection, and we're gonna ignore the fact that our test dummy does have some contraindication. But you completely inspect the skin. That way you know what the quality of the skin is like at the start of the treatment, so that if anytime during the treatment you notice any changes or at the end, then you'll know that there was an issue with either the amount of pressure or the stockinette or something wasn't right. So after completing your thorough skin inspection, then we're going to go ahead and assess the patient's sensation. And so you're going to go through the dermatomes and doing your sensation testing with your patient so that you cover your dermatomes, making sure you've covered the entire limb to test for sensation. In the interest of time in your comp, we'll probably just say to focus on maybe 4 attempts in each area of the limb, just for the interest of time. But in the clinic, more than likely the PT would have done this before. It would be recorded on your eval. If not, then you would do it on that first session with the patient and record it in your notes. Then we need to take their girth measurements, because we need to be able to see if the intermittent compression is having the positive effects that you want. Again, in the interest of time, we won't have you go through the entire method of girth measurements, but what I would say you do is we're going to do a couple key landmarks. So you would do around the metatarsal heads, you take a measurement there, you take a measurement at the ankle. From the ankle, we do 6 inches up and take a girth measurement, right? So we go 6 inches from the ankle, take a girth measurement. Do another 6 inches from there. So we're at the upper leg. Take a measurement. We measure at the knee. And we do 6 inches above the knee. So we're at about mid-thigh. And then depending on the patient's length of their limb, we do another 6 inches from there. So with this patient, I can't go all the way 6, so I would just stop at 4, otherwise I'd be in their groin, and I would take my girth measurements. So for the interest of time in your skills check, we won't go through all the smaller denominations. We're just going to do an estimated version. So once I've completed my skin check, I've done my sensation test, and I've done my girth measurements. Oh, I forgot to leave my call bell, so I'm going to leave the call bell on the side here for the patient. Then I'm going to apply the stockinette. So you can have an area where you can have a chair or a stool where your equipment is going to be set up that you're able to move back and forth to gather your supplies. So then I'm going to apply the stockinette. So everyone is going to measure their own length of stockinette for themselves. And I'm going to place it on the patient's foot. So you want to make sure that you're not having to pull too much. So you want to roll down the stockinette. And when you're cutting your stockinette, the longer the better. And I'll show you why. So this one's going to be very exact for this patient's limb. So you want it to reach to just about the proximal thigh, because you want it to the length of the sleeve so that there's no touching of their skin against the machine. And the reason you want it long at the end is so that you can just give it a quick tug and you smooth out any wrinkles, because remember, one of the precautions is that wrinkles in the stockinette can cause bruising when we have high pressure. So once I've applied my stockinette, then I can get my sleeve. So since I'm treating the lower extremity, so I have to have the lower extremity sleeve, and then also the type of machine that I'm using, I would need to have the single chamber machine. So in the same way that I gently lifted the leg to put the stockinette on and also to do the assessment. It's the same way I'm going to gently lift their leg. So I'm standing this direction just so it's easier for you to see. But I'm going to lift the lid and place the sleeve underneath. So once the sleeve is placed, I'll zip the sleeve up. And then I'll attach the hose. So what you want to be mindful of is when you get your case, you want to think about where the machines are located, because more than likely the machines themselves won't be able to be moved, but where the machine is located, what side of the body that you will be treating, so that you make sure that the limb that you're treating is closest to the machine, because you don't want to have to be having the hoses move over your patient in order to be attached, right? So I'm going to attach the sleeve, and I will show you here that this is where the port is. And so you would open port, the sleeve is falling over it, and then you would insert. So that's how you would apply your, or attach your sleeve. Okay, so then once the sleeve is attached, I'm going to set my parameters. So I'm using the precision machine, which is going to, this is the one machine that I need to set before I turn the machine on for my patient. So I'm actually going to rotate. I'll have to stop the video to rotate the camera. So it's going to be backwards. But to set my inflation pressure, I'm treating the lower extremity. So I'm going to set it to 40 millimeters of mercury. My off time, so remember we want a 3-to-1 ratio. So my off time is going to actually be 10 seconds off. So I'll set it to 10 seconds there. And then 30 seconds on for my inflation pressure. And then my machine is set. The other two machines, the only thing you'd be setting is the inflation pressure, and you would actually have to wait to turn your machine on to be able to set that. Okay. So once your machine is set, then I can get ready to kind of assess if my patient can tolerate that level. So I'll go ahead now that my machine is set and turn my machine on. So this is where I would have to check with my patient during that first inflation. Are you doing okay? So I allow the machine to inflate, and then I find out if they're doing okay. Then the other thing I need to do to see if the patient is tolerating it well is I'm going to come to the end here. I'm going to bring it up so you can see. So that was the end of my first inflation. And then what I'm going to do is I'm going to open the sleeve. I'm not going to open the sleeve. I'm going to stick my hand in the sleeve. I'm going to separate the stockinette and just ask my patient to wiggle their toes. So that's all I'm doing, right? Just asking them to wiggle your toes. So can you wiggle your toes? Okay. So as long as they can wiggle their toes comfortably and they respond that the amount of compression that they're getting is okay, then I know that they can tolerate that pressure. So one other thing I have to check before I can start. So I'm going to turn my machine off. And then this is where I'm going to go ahead and check with my patient. I'm going to do my second skin inspection. So I may or may not need to detach the hose, so I'm able to open the sleeve. So I'm going to open the sleeve. And then I'm going to do a brief proximal and distal skin inspection. So I'm just going to pull the stockinette back, and I'm just going to look briefly. I'm just looking to see, do I see any redness or anything after that first inflation, if it was too hard. Then I come to the foot, and I do the same thing. I roll it down a little bit to about the ankle, and I look, and then I slide it up. And then this is where, when it's a little bit long, it helps to check proximal, check distal, then give it a tug, and it smooths everything out. Then I go ahead and close my sleeve again. And now I'm actually ready to start my procedure. So now I'm ready to start. So I'll let my patient know that I'm going to start the procedure. If they have their call bell, if they need anything, they know how to use it, and then I'll let them know. So this is where you're going to set the timer for your 5-minute check. So that will be, you set and start the timer for the 5-minute check. So you start your machine, you let your patient know, and you're back. So then you'll come to one of us and we'll check and we'll say, okay, your 5 minutes has ended. So this is where you do a verbal check on your patient. So, are you doing okay? We'll be back in another couple of minutes to check on you. So now you're actually setting the time for the rest of your treatment session. So since we don't have timers that go all the way up to 2 hours, you're just gonna set your timer all the way for an hour. So you'll set it and you'll start it, and that way we'll know that you know that your treatment time is at least 60 minutes or more. So then we'll say to you, okay, your treatment time has ended. You'll stop your timer. You'll come on over, you'll turn off your machine, and you check, how are you doing? Are you doing okay? So you'll check on your patient. The sleeve will deflate, but I will say for your treatments, we'll try our best to make sure it doesn't inflate on you. So you can unhook the sleeve.
I'll see you Tuesday.
Okay. So we unhook the machine, you remove the sleeve, and when you place the sleeve, you want to make sure the sleeve remains, we keep the sleeves flat. So you remove the sleeve, and then you remove the stockinette. So again, just still being gentle, because sometimes that skin is really sensitive as well. All right, so once the sleeve, the stockinette is removed, then I have to do my third and final skin inspection. So again, it's going to be a detailed skin inspection, proximal, distal, anterior, lateral, checking the bottom of the foot, checking between the toes, also checking posterior to see. And then we do our girth measurements at the end as well. You just verbalize that. We won't make you take them again. But then we would also do girth measurements at the end to make sure that your patient, that you saw some changes with their limb length, or limb girth, I should say, with the treatment. So once you've done all of that, you've checked them and the patient's doing okay, we'll go ahead and we'll remove the pillows. We'll remove the wedge. And then you assist your patient to sit up, put their shoes on, and leave. And then that would be the application of your intermittent compression. And the end of your skills check.